Well, hey, everybody, this is Robert, and welcome to today's show. Now, brucellosis is among the leading communicable diseases worldwide, and the disease poses a substantial public health burden in many parts of the world, but particularly the Middle East. And it results in long term illness in humans and a significant economic loss in livestock production. In addition, some Brucella species are classified as Category B bioterrorism agents by the CDC. Now, my guest today was awarded a $3 million grant by the Defense Threat Reduction Agency of the DoD, and that's to study one of the most important infectious diseases in humans and livestock in Iraq. So, joining me today to discuss brucellosis and the work in Iraq is Jeff Foster, Ph.D. Dr. Foster is an associate professor at Northern Arizona University's Pathogen and Microbiome Institute. Dr. Foster, welcome to the show, sir.
Yes, thanks so much, Robert, for the invitation.
Yes, you bet. You bet. And I don't believe I've done a podcast on Brucella yet, so this will be the first out of about 500 podcasts.
Oh, wow.
Yeah. So you're the first on this interesting agent that I've actually isolated from blood cultures before. So let's go ahead and start, Dr. Foster. Before we get into what you and your collaborators are going to be doing in Iraq, let's give the audience a primer on Brucella and brucellosis, the disease, the bacteria and the disease. Of course, Brucella is the cause of brucellosis. It's a bacteria. It's considered zoonotic. Where is brucellosis found commonly around the globe, other than the Middle East, which I mentioned in the intro?
Thanks for that introduction. Brucellosis occurs in almost every country worldwide. And so it's really a ubiquitous pathogen. We've eradicated it, or at least gotten it down to really low numbers in the US and Canada and parts of Western Europe. But really, the rest of the world has high numbers of cases in many places. And so you mentioned the Middle East, particularly parts of the former Soviet Union and across Asia. It's likely quite high in Africa too, but there's many unknowns in terms of sampling both humans and animals in Africa. So that's a bit of an unknown. But yeah, it's almost everywhere that we have livestock, and we spread it globally, and we in fact have work on that global spread.
Right. Do we have any idea what the human case count is globally?
Yeah, so there was a study, I believe, in the 2000s by a group out of Greece with an author named Pappas that estimated about 500,000 cases annually. But there's a recent study, it's still unpublished, by a guy named Chris Lane at Texas A&M that suggests that number is, that number by Pappas is a severe underestimate. And the real number is likely in the millions, almost certainly in the millions.
Yeah. And you mentioned that here in the U.S., Western Europe and Canada, we're doing a pretty good job of getting rid of it, I guess, for lack of a better term.
Yeah.
What are we seeing? A couple hundred cases a year?
Yeah, that's exactly right. In the U.S., we 100 or 200 cases is typical. Nearly all of those, in fact, almost all of those, are coming from travelers, particularly travelers to Mexico and Central America, but also other parts of the world. And so Americans are typically infected internationally, but then are diagnosed when they come back.
Yeah. Now, the Brucella species are usually tagged, each species is tagged to a different animal. Is there certain species that are more significant than others?
Yeah, that's right. So most species are thought to be relatively host specific, although that's not, a certainty. And so Brucella melitensis is globally the most important species. It's typically found in goats and sheep, but it can also be found in a range of other animals, particularly, say, camels, if they're in the same, locations as goats and sheep. It's even been found in catfish in the Nile. And so
Wow.
and of course, it's the number one human infection as well. And so what we see is, in terms of animal infections, human infections follow, since it is a zoonotic disease and we're getting them from the animals that we eat.
Um, and of course, it's an issue with humans because of its pathology. But with animals, and it's a major pathogen in animals, it goes to economic significance too, right?
Yeah, that's exactly right. And so, much like the human brucellosis estimates, the numbers are uncertain, but we're getting better and better about it. But the estimate of animal infections is certainly in the tens of millions, potentially hundreds of millions of animals being infected. So we have billions of livestock kind of available worldwide. And so, easily tens of millions of infected animals. And on a herd level basis, which is how it's typically measured, most herds in the world are infected with brucellosis. So at least one infected animal. So it is a major, major disease. But it's we'll get to this. It's so difficult to control that a lot of places have almost given up.
It, um, it, I mean, getting a little ahead of myself. It's treatable in humans with antibiotics. Is the treatment similar in animals?
So treatment is typically ineffective or difficult
Mhm.
or too expensive in
Yeah.
animals. And so in
Yeah.
most cases, animals are slaughtered instead of treated. And so that's another difficult part of it. You say you go to a country, part of the developing world where livestock are a key part of their economies. You can't just go in and cull half the animals in these herds
Mhm.
without kind of having a plan for that. And so these animals are so valuable to these communities that culling is not an option.
Yeah. Um, so we see strains in goats, we see strains in pigs and cows. In a apparently, would you say fish? I think you said fish.
Yeah, fish. So
Yeah,
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 it's
yeah.
a good
That
point. So it's in lots of different livestock, and the more we look, the more we're finding it in all these other animals that we never expected to be hosts.
yeah. So because of that, this is typically how people become infected, right? It's a zoonotic infection.
Yeah.
Can you talk about how people contract brucellosis?
Yeah, most times people get infected by consuming contaminated and unpasteurized dairy products. And so typically it's through milk or cheeses. And that pasteurization is a key part. Pasteurization was not solely for brucellosis, but certainly is one of the big pathogens that we aim to control with pasteurizing our milk and dairy products. And so most people are getting infected by eating it. Also, veterinarians are highly at risk, and farm workers, particularly farm workers who are involved in animal birthing. And so billions, perhaps trillions of bacteria are projected out during the birthing process, and slaughterhouse workers. And so we can go and do serological studies and find that people exposed to animals, particularly kind of the insides of animals, are most at risk.
Yeah, and just to piggyback on that is it's also can be a laboratory acquired infection.
Yep, yeah, it depends on which year you're looking at, but
Yeah,
it's the number one in most cases laboratory acquired infection.
yeah. Um, and I picked out something out of the press release that I found interesting. Uh, like I said in the intro, it's classified as a Category B bioterrorism agent. It's a lower priority than, say, anthrax or the plague. However, something you stated, I want to hear your thoughts on it. You stated that brucellosis poses a more significant risk than all the other diseases on the bioterrorism list combined. That's including anthrax, plague, tularemia, and several others. What were your thoughts on that statement?
Yeah, so part of it is a bit of frustration in that, the other ones get all the money, but
Uh,
the people in brucellosis feel like because it poses such a huge burden,
mhm.
but to both animals and humans worldwide, it's really kind of overlooked. And part of that is that it is so ubiquitous. You can get it in almost any country, in almost any herd. And so you can't say that about any other kind of bioterrorism or biowarfare agent. And so it is just so common, particularly in unstable regions of the world. It was also, and I don't know the full kind of history of biowarfare programs, but in the 40s and 50s, I believe, Brucella was one of the agents that the US and several other countries developed as a biowarfare agent. And so many of those species that are on the list as bioterrorism agents were initially part of biowarfare programs. And we know that Brucella is among the most infectious agents out there.
Right.
Uh, say a few cells, maybe only Coxiella burnetii is more infectious. So it's incredibly infectious and hard to control and available everywhere.
But I would guess the reason the other ones get more attention is because they're more lethal.
Yep. Yeah, that's
Right.
exactly right. So
Yeah.
good point is and anthrax is, for example, Bacillus anthracis spores are highly stable, and so that
Yeah.
makes them kind of a bit scarier. So yeah, you raise a great point. Brucellosis is rarely fatal. It just makes people miserable, and
Yeah.
it's hard
Right.
to control, and we'll talk about that. But it doesn't kill people.
Okay. Well, let's jump into that right now. Uh, Dr. Foster, can you go ahead and talk a little bit about the human pathology of brucellosis?
Yeah, so yeah, it's rarely fatal, but it makes people, it's a chronic, debilitating disease. So it makes people miserable for a long period of time. So, an undulating fever that kind of comes and goes, joint pain and arthritis, and potential effects on the reproductive system. And so, we think about it mostly in animals, but it also affects the reproductive system of humans as well. And I think the key point here is that it's difficult to treat, and we'll talk about that in a sec, but it's chronic and debilitating. And a lot of people don't get diagnosed with it for months, if not years, after they get infected.
Right. And it is a bacteria and it is treatable with antibiotics. However, the treatment is lengthy, to say the least.
Yeah, so it's roughly for 2 months of doxycycline and rifampin, which is a kind of a typical treatment regimen out there. There's a couple other antibiotics that are used sometimes if you're can't handle doxycycline or rifampin. But yeah, it's 2 months on antibiotics is not pleasant, and sometimes people relapse. And so yes, it's an extended period to be taking antibiotics.
Okay. Good stuff. Let's go ahead and switch gears, and I want to hear more about the work you're going to be doing in Iraq, and you know uh, why Iraq.
Yeah, so the Department of Defense, Defense Threat Reduction Agency, which you talked about in the introduction, has a biological threat reduction program. And so part of this is an initiation of training programs for both working with infectious diseases worldwide, as well as how to kind of plan for controlling those diseases. And so it's all about getting primarily US researchers to be collaborating with experts in country and providing and transferring our expertise to them so that they can independently do this work after we leave. And so the DTRA's Biothreat Reduction Program is really about international collaboration and kind of making these people in these countries, uh, stand on their own for public health, disease detection, and biosecurity.
Do we have any idea what the situation is Iraq now? I mean, do they have estimates about the numbers in Iraq? And if you know that, are you expecting to find out there's probably a lot more than the estimates say?
Yeah, so there have been studies for sure, and but part of this program is really making sure those studies are done so that the results are up to international standards. And so detection is normally done through serology, but serology in Brucella can be tricky, and
Right.
so part of that is making sure that the training is sufficient so that you're detecting it. And so almost, yeah, it is by all accounts, a common disease in Iraq in both humans and people, and we in humans and
Very nice.
animals, and we
Mhm.
really need to kind of drill in and attack that with kind of more sophisticated approaches.
Yeah, and and I saw that I don't know 2019ish. You did similar work in Turkey and Georgia and another country or two.
Yeah.
Was there any big difference between the work that you did, or and then what you're going to do, or and what were your findings? Or
Yeah, so we're still working with Turkey, Georgia, and Azerbaijan, and we
Mhm,
also have a project with Texas A&M and Cameroonian collaborators. So
mhm,
again, this is a global disease, and you can actually use similar approaches in many countries, not all countries, just by providing these trainings and providing our expertise. And so we're using a similar approach in Iraq as we have in these other countries, where we're helping our collaborators identify, figure out how common it is, and then genetically looking at the strains and making genetic connections between human and animal strains.
good stuff. Dr. Foster, any final thoughts on Brucella, brucellosis, um, the situation around the globe? Any
Yeah.
final thoughts?
Yeah, as I think I've suggested, brucellosis, I'm passionate about Brucella. It feels weird saying that, but it's such an incredibly important disease, and it's so frequently overlooked. It has symptoms that are consistent with, say, malaria, or dengue fever, and so it's often underdiagnosed and overlooked. And so we don't think about it much in the US, but the rest of the world really thinks about it because it affects so many people and animals. And what I think is really interesting is that we've been living with brucellosis for thousands of years. And so if you go back and look at skeletons, say from the Bronze Age, you can find lesions consistent with brucellosis on those skeletons.
Mhm.
And so we've been living with brucellosis for at least thousands of years and perhaps millions of years. And so some skeletons of early hominids may have lesions consistent with Brucella. So it's an important disease. It's lots of places, but and we've been living with it for a long time. But it is incredibly hard disease to eradicate, and so it'll take a consistent and global effort to really eradicate it.
Yeah, yeah, it's not necessarily an easy thing to eradicate a zoonotic infection, right?
No, no.
Yeah, yeah. Okay. Well, thanks, Dr. Jeff Foster, for sharing your time and expertise. Congratulations on the grant, and thank you for doing the good work with this overlooked organism.
Thank you, Robert. I really appreciate it.
You bet.